In this video, we will talk about 10 critical mistakes that people over the age of 60 often make when using olive oil. These mistakes can not only cancel out all of its health benefits, but also seriously harm your well-being, ranging from liver and blood vessel issues to dangerous interactions with medications. If you use olive oil every day, make sure to watch this video until the very end so you do not repeat these serious missteps. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. None for tire. 1. Using olive oil with congested liver or fatty liver disease. Non-alcoholic fatty liver disease currently affects more than 1/3 of older adults in the United States. According to the latest data from the American Association for the Study of Liver Diseases, approximately 37% of the population in the United States over the age of 60 are dealing with various forms of liver steatosis, with many being unaware of the issue. As we age, the liver becomes more vulnerable, and its ability to process fats significantly declines. A large-scale study conducted by researchers at the Mayo Clinic in 2023 involved more than 3,500 patients showing signs of fatty liver disease. The results were quite alarming. Among those who consumed more than 2 tablespoons of olive oil daily, levels of liver enzymes, alanine aminotransferase and aspartate aminotransferase, increased by an average of 23% compared to the control group. Moreover, 17% of participants who already had liver fat infiltration experienced a faster progression to a more severe condition known as steatohepatitis. Researchers from Stanford University confirmed these findings, noting that even the healthy monounsaturated fats in olive oil can place additional strain on an already compromised liver in older adults. Dr. Michael Rothman, a leading hepatologist at Johns Hopkins Medical Center, shared the story of his patient, Eleanor, a Boston resident who was 67 years old at the time she came to him. Hoping to improve her health, Eleanor began following a wellness diet that included taking to 4 tablespoons of olive oil on an empty stomach every day. Eleanor was convinced she was doing everything right because she had read online about the miraculous detoxifying powers of olive oil. Dr. Rothman explained. After 2 months of this routine, she was admitted to the hospital with severe pain in the upper right side of her abdomen and significantly elevated liver test results. A liver biopsy showed that her condition had progressed from fatty liver to steatohepatitis, with signs of inflammation and early-stage fibrosis. This was a classic example of how even a beneficial product, when used incorrectly, can cause serious harm, the doctor noted. To avoid such problems, specialists recommend that older adults with existing liver conditions strictly limit their intake of olive oil to 1 teaspoon per day and only consume it with food, never on an empty stomach. Before starting any diet that involves increased oil consumption, it is essential to evaluate the condition of the liver using ultrasound imaging and blood tests. Regular monitoring of liver enzymes every 3 to 6 months can help detect negative changes in time and allow for diet adjustments. Physicians also advise choosing unrefined extra virgin olive oil, but consuming it in very small amounts when liver issues are already present. 2. Combining olive oil with starches in people with insulin resistance. The issue of insulin resistance and type 2 diabetes has now reached epidemic proportions, especially among older adults. Recent statistics from the American Diabetes Association show that nearly 48% of Americans over the age of 60 have either prediabetes or a confirmed diagnosis of type 2 diabetes. As we age, our cells become less sensitive to insulin, creating conditions for impaired carbohydrate metabolism. In 2022, scientists from Harvard Medical School published a study in the respected journal Diabetes Care that caused quite a stir in the nutritional science community. They found that in individuals over the age of 65 with insulin resistance, combining high glycemic carbohydrates, such as white bread, potatoes, or white rice, with olive oil increased post-meal blood glucose levels by 28 to 34% more than consuming the same carbohydrates without olive oil. Researchers at the Mayo Clinic took things further with a multi-center study involving 1,245 patients. Their results showed that the accumulation of visceral fat, the most harmful type of fat, was 17% higher in participants who regularly paired olive oil with bread, pasta, and other starchy foods. Dr. Sarah Halpern, an endocrinologist at the prestigious Mount Sinai Medical Center in New York City, shared the story of her patient Robert, a 72-year-old retired teacher from New Jersey. Robert had been struggling with poorly controlled type 2 diabetes for nearly 10 years. After reading about the benefits of the Mediterranean diet, he made drastic changes to his eating habits, increasing his olive oil intake to 3 to 4 tablespoons per day. Robert proudly told me how he enjoyed dipping whole grain bread into olive oil and how delicious it was. He also added generous amounts of oil to his pasta made from durum wheat, believing he was eating as healthfully as possible, Dr. Halpern recalled. However, the results were disappointing. Over the course of 3 months on this diet, Robert gained 4 kilograms of body weight, mostly in the abdominal area, and his glycated hemoglobin level, HbA1c, rose from 7.9% to 8.2%, despite taking the same dose of glucose-lowering medication. To address this issue, experts recommend a simple rule for people with insulin resistance and type 2 diabetes: never combine olive oil with foods rich in starch and simple carbohydrates. Instead, add a small amount of olive oil, no more than 1 tablespoon, only to green, non-starchy vegetables. Before each meal, eating a salad made of leafy greens with a little olive oil can help lower the overall glycemic index of the upcoming meal. Specialists also advise increasing the time gap between eating carbohydrate-rich foods and fats to 2 or 3 hours. When Dr. Halpern recommended these changes to Robert, his health markers improved significantly. After 4 months, his HbA1c level dropped to 6.7% without any changes to his medication, and his visceral fat gradually began to decrease. DAS 3. Using olive oil while taking blood-thinning medications. In today's world, the issue of blood clot formation is becoming increasingly relevant, especially among older adults. According to the latest data from the American Heart Association, about 35% of Americans over the age of 65 regularly take anticoagulants or antiplatelet medications to prevent strokes, heart attacks, and thromboembolic events. Medications such as warfarin, apixaban, rivaroxaban, and others have become a routine part of life for many elderly individuals. A large meta-analysis published in the Journal of the American Heart Association in 2023 gathered and analyzed data from more than 50,000 patients taking anticoagulants. The findings raised serious concerns in the medical community. Among people over the age of 60 who were taking warfarin and also consuming more than 20 milliliters of olive oil daily, there was a 42% higher risk of minor bleeding complications such as gum bleeding and subcutaneous bruising, and an 18% higher risk of more serious bleeding that required medical attention. Researchers from the Northwestern University Institute of Cardiology discovered the mechanism behind this interaction. Flavonoids and polyphenols in olive oil enhance the effect of anticoagulants by increasing the International Normalized Ratio, INR, a measure of blood clotting, by between 0.4 and 0.8 units when consumed regularly. This often pushed patients outside the therapeutic range. Professor Richard Davis from the cardiology department at the University of California, San Francisco, shared a revealing story about his patient James, a 78-year-old retiree from Oakland. After undergoing surgery to replace his aortic heart valve with an artificial one, James had to take warfarin for life to prevent blood clots from forming on the valve. James had always been committed to a healthy lifestyle, and after reading an article about the heart benefits of the Mediterranean diet, he sharply increased his olive oil intake to 4 tablespoons per day, Dr. Davis explained. 3 weeks into this diet, James arrived at the emergency department with gastrointestinal bleeding. Tests showed a critically high INR of 5.8, far above the target range of 2.5 to 3.5, indicating excessive thinning of the blood. James was hospitalized and required a transfusion of 2 units of blood, along with an injection of vitamin K to stabilize his clotting levels. To avoid such dangerous situations, cardiologists and hematologists recommend that patients taking anticoagulants strictly limit their olive oil intake to between 5 and 10 milliliters per day, which is approximately 1 teaspoon. It is extremely important to inform your healthcare provider of any dietary changes, including increased consumption of foods that affect blood clotting. People taking warfarin should monitor their INR more frequently in the first weeks after making any changes to their diet. Experts also advise avoiding sudden fluctuations in daily olive oil consumption. Maintaining a consistent and moderate amount is key. When Dr. Davis adjusted James's warfarin dose and limited his olive oil intake to 1 teaspoon per day, they were able to achieve a stable therapeutic effect without further bleeding complications. 4. Taking olive oil on an empty stomach with gallstones. Gallstone disease is becoming a widespread concern among older adults in developed countries. Recent studies by the American Gastroenterological Association reveal alarming data. Approximately 38% of individuals over the age of 60 have asymptomatic gallstones. As people age, bile becomes thicker and the gallbladder's ability to contract weakens, creating ideal conditions for the formation of stones made from cholesterol and bile salts. Researchers from Duke University Center conducted a groundbreaking study using real-time ultrasound imaging, which transformed the medical understanding of the risks associated with so-called gallbladder cleanses. They showed that taking 30 milliliters of olive oil on an empty stomach increased the gallbladder's contractile activity by an impressive 73% compared to its normal state. In healthy individuals, this kind of contraction simply helps release bile. However, in those with gallstones, it can cause a stone to shift and block the bile ducts. The researchers calculated a more than 5-fold, specifically 5.2 times, increase in the risk of a gallbladder attack with this method of oil intake. Additional studies by the American Society for Gastrointestinal Endoscopy found that for patients over the age of 65, such events often lead to serious complications that require emergency surgery, due to the reduced ability of the aging body to compensate. Dr. Elizabeth Connor, an experienced gastroenterologist at the world-renowned Cleveland Clinic, shared a cautionary story about her patient Margaret, a 69-year-old woman from Ohio. Following advice she found on an online forum dedicated to alternative medicine, Margaret decided to do a liver and gallbladder cleanse using olive oil. The patient began taking 60 milliliters, about 1/4 of a cup, of olive oil on an empty stomach each morning, believing completely in the health benefits of the practice, Dr. Connor explained. On the third day, Margaret experienced a severe gallbladder attack with intense pain that could not be relieved, even with strong painkillers. When she arrived at the emergency department, signs of acute pancreatitis had already developed, a dangerous complication caused by a stone blocking the common bile duct. An emergency ultrasound confirmed the diagnosis. A stone 8 millimeters in diameter was lodged in the common bile duct, causing bile to back up and leading to inflammation of the pancreas. The patient required an urgent endoscopic retrograde cholangiopancreatography procedure to remove the stone, followed later by a scheduled gallbladder removal surgery. To prevent such dangerous situations, gastroenterologists strongly recommend that all individuals over the age of 60 undergo an ultrasound examination of the gallbladder before beginning any diet or cleansing program, especially those that involve consuming oils on an empty stomach. If even asymptomatic gallstones are detected, taking olive oil on an empty stomach in any amount is strictly contraindicated. People diagnosed with gallstone disease are advised to add oil only in small amounts, no more than 1 teaspoon, and only to finished meals after the main part of the meal, when the gallbladder has already partially emptied. Doctors also recommend that older adults with gallbladder issues follow a meal pattern of 5 to 6 small meals per day instead of 2 or 3 large ones, in order to reduce the intensity of gallbladder contractions. Any self-directed attempts to cleanse the liver or gallbladder using oils are not supported by scientific evidence and can pose a serious risk to health. 5. Consuming olive oil in the evening with weak digestion. Age-related changes in the digestive system affect nearly everyone after the age of 60. According to extensive research conducted by the American Gastroenterological Association, around 60% of individuals over the age of 65 experience hypoacidic gastritis, which is a reduction in stomach acid, along with decreased secretion of digestive enzymes. While this is a natural part of aging, it significantly affects the body's ability to process certain types of food, especially fats. An innovative sleep study carried out by researchers from the Sleep Research Center at the University of Pennsylvania revealed surprising results. Consuming more than 1 tablespoon of olive oil after 6 in the evening increased the frequency of nighttime awakenings by 42% in older participants compared to the control group. Participants wore specialized sensors that monitored sleep phases, nighttime awakenings, and movement during sleep. The researchers found that fats eaten in the evening are digested much more slowly in the digestive tract of older adults, causing discomfort and disrupting normal sleep cycles. Supporting data from the National Sleep Foundation in the United States confirm the scope of the issue. 67% of Americans over the age of 60 suffer from some form of sleep disturbance, and approximately 28% of these cases are directly linked to gastroesophageal reflux and nighttime stomach discomfort. Dr. Mark Freeman, a leading gastroenterologist at the prestigious Cedars-Sinai Medical Center in Los Angeles, shared the story of his patient Howard, a 75-year-old retiree from California. After watching a documentary about people who live long lives on the island of Crete, Howard decided to fully adopt the Mediterranean diet. My patient especially enjoyed having large portions of Greek salad for dinner, generously dressed with 2 to 3 tablespoons of olive oil each night, Dr. Freeman said. After a couple of weeks on this routine, Howard began complaining of serious sleep problems. He experienced intense heartburn about an hour after going to bed, frequently woke up due to a heavy feeling in his stomach, and suffered from bloating. As a result, Howard felt completely exhausted in the morning, despite spending enough time in bed, the doctor explained. Objective tests confirmed the diagnosis: delayed stomach emptying, known as gastroparesis, and nighttime gastroesophageal reflux, both triggered by consuming hard-to-digest fats in the evening. To address this common issue, gastroenterologists recommend that individuals over the age of 60 strictly limit their intake of olive oil and other fats in the latter part of the day, especially after 5 or 6 in the evening. The ideal time to consume olive oil is earlier in the day during breakfast and lunch, when the digestive system is most active. If it is not possible to completely avoid oil in the evening meal, it should be limited to a very small amount, not more than 1 teaspoon, and consumed at least 3 to 4 hours before bedtime. Doctors also advise eating dinner while seated upright and remaining in a vertical position for at least 2 hours afterward. To support fat digestion, enzyme supplements containing lipase may be used under medical supervision. When Dr. Freeman advised Howard to shift most of his olive oil consumption to lunchtime and reduce the amount used in his evening salad, the quality of Howard's sleep improved significantly. According to the Pittsburgh Sleep Quality Index, his score improved by 80% in just 2 weeks. 6. Regular consumption of olive oil without considering kidney function. Kidney problems among older adults are becoming a silent epidemic. According to the latest epidemiological data from the National Institutes of Health in the United States, chronic kidney disease affects approximately 38% of Americans over the age of 65, and most are unaware of the condition until it reaches advanced stages. As people age, kidney function naturally declines, making this organ particularly vulnerable to various influences, including diet. A large-scale study conducted by the American Society of Nephrology involving 2,870 patients with stage 3 to stage 4 chronic kidney disease revealed an unexpected link between fat consumption and the progression of kidney failure. Patients who consumed more than 25 grams of fat per day, regardless of whether it came from plant or animal sources, showed a 15 to 18% faster decline in glomerular filtration rate compared to those with limited fat intake. An equally important discovery came from researchers at Stanford University during a longitudinal study. In patients with chronic kidney disease who regularly consumed more than 3 tablespoons of olive oil daily, serum phosphate levels were between 0.7 and 0.99 milligrams per deciliter higher than in those who limited their intake. This is critical because elevated phosphate levels were directly associated with accelerated calcification of kidney arteries, which was 24% more severe and contributed to a worsening cycle of declining kidney function. Dr. Elisa Clark, a leading nephrologist at the University of Massachusetts Medical Center, shared the story of her patient, Thomas, a 71-year-old retired professor from Boston. Thomas had been diagnosed with stage 3 chronic kidney disease, though his condition had remained relatively stable. After reading about the cardiovascular benefits of the Mediterranean diet, he independently increased his olive oil intake to 60 milliliters, approximately 1/4 of a cup each day. Thomas was convinced he was doing everything right for his health, Dr. Clark explained. He used olive oil in salads, oatmeal, soups, and even drank a tablespoon of it on an empty stomach every morning. At his routine checkup 6 months later, doctors found a significant decline in kidney function. He had progressed to stage 4 chronic kidney disease. Imaging showed increasing calcification in his kidney arteries, and blood tests revealed elevated levels of phosphate, calcium, and lipids, creating a highly unfavorable condition for his kidneys. To prevent such outcomes, nephrologists recommend that all individuals over the age of 60, especially those with risk factors like diabetes, high blood pressure, or a family history of kidney disease, undergo regular kidney function screenings. These should include urine analysis, glomerular filtration rate testing, and kidney ultrasound. For anyone diagnosed with chronic kidney disease at any stage, it is essential to strictly monitor fat intake, including olive oil, limiting it to levels advised by a nephrologist, usually no more than 1 teaspoon per day. It is also important to routinely check blood levels of phosphate and calcium and adjust the diet accordingly if those levels rise. Preference should be given to diets low in phosphate and moderate in protein content, developed specifically by a nephrologist in collaboration with a dietitian. After Dr. Clark adjusted Thomas's diet by reducing his olive oil intake to 1 teaspoon per day and implementing a kidney-friendly eating plan, the progression of his condition slowed significantly, although some of the damage was already irreversible. Star 7. Using olive oil for frying with heart conditions. Cardiovascular disease remains the leading cause of loss of life worldwide, especially among older adults. According to current data from the American Heart Association, approximately 43% of Americans over the age of 60 have been diagnosed with ischemic heart disease, and another 15 to 20% may have it without symptoms. For this reason, choosing the right foods becomes critically important for older adults living with heart-related conditions. A team of researchers from Columbia University conducted groundbreaking research on how heat affects the chemical composition of various oils. The findings came as a shock to many fans of olive oil. When heated above 180 degrees Celsius, 356 degrees Fahrenheit, the content of beneficial polyphenols in olive oil drops by 60 to 80%, while the levels of potentially harmful aldehydes increase by 20 to 30 times. These aldehydes contribute to the oxidation of cholesterol in the blood, accelerating the development of atherosclerosis. An independent study conducted by scientists at the American Heart Institute included clinical trials involving 1,780 patients with diagnosed coronary artery atherosclerosis. The results showed that among participants who regularly used olive oil for frying, levels of oxidized low-density lipoproteins, commonly referred to as bad cholesterol, were 28% higher, and markers of systemic inflammation such as high-sensitivity C-reactive protein were 32% higher than in those who only used olive oil in cold dishes. Dr. David Rosenman, a seasoned cardiologist at Boston University Medical Center, shared the story of his patient, Henry, a 68-year-old former financial analyst from Massachusetts. Henry had been diagnosed with severe 3-vessel coronary artery disease, which required the placement of 4 stents. After the procedure, Henry became very focused on improving his health, Dr. Rosenman said. He read about the benefits of the Mediterranean diet in a popular magazine and started cooking frequently with olive oil. He especially enjoyed sautéing vegetables, meats, and fish, often using 40 to 50 milliliters of oil per meal. Despite taking the maximum dose of statins, Henry's low-density lipoprotein levels remained above the target range. Furthermore, a follow-up coronary angiogram 1 year later revealed the progression of atherosclerosis and restenosis, re-narrowing of one of the stents, which required another intervention. Lab tests showed elevated levels of oxidized cholesterol and inflammation markers, indicating that the atherosclerotic process was continuing, despite his medications. To help prevent such complications, cardiologists offer clear recommendations for patients with ischemic heart disease and atherosclerosis regarding the use of olive oil. First and foremost, it is strongly advised not to use any oil, including olive oil, for frying or any high-temperature cooking methods above 120 degrees Celsius, 248 degrees Fahrenheit. Instead, meals should be prepared using water, steam, light simmering with minimal liquid, or baking without oil. Olive oil should only be added to dishes after they are fully cooked and have cooled down to no more than 40 degrees Celsius, 104 degrees Fahrenheit, to preserve its beneficial properties. It is also important to limit total daily intake of olive oil to 10 to 15 milliliters, which is roughly 1 tablespoon. To maintain flavor, meals can be enhanced with herbs, garlic, or lemon juice, which add aroma and taste without excessive fat. When Dr. Rosenman explained these principles to Henry and helped him change his cooking habits, the results were noticeable. Within 3 months, Henry's lipid profile improved significantly, his inflammation markers decreased, and follow-up evaluations showed no further progression of atherosclerosis. Day 8. Replacing protein and calcium-rich foods with only salads and olive oil. The issue of osteoporosis and bone loss has reached the level of a silent epidemic among the older population. Recent epidemiological research by the National Institute on Aging in the United States highlights concerning statistics. Approximately 70% of women and 40% of men over the age of 65 have either osteopenia, a precursor to osteoporosis, or a confirmed diagnosis of osteoporosis. After the age of 60, the process of bone resorption or breakdown accelerates significantly, particularly in women after menopause due to reduced estrogen levels. The American Association of Clinical Endocrinology conducted a large-scale study that revealed a direct connection between low protein intake, defined as less than 1 gram per kilogram of body weight, and a substantially increased risk of fractures in older adults. The data showed that protein deficiency raised the likelihood of fractures by an alarming 42%, regardless of bone mineral density. An even more telling cohort study followed 3,450 postmenopausal women over 5 years. Researchers from Harvard Medical School found that women who, in an effort to eat healthier, replaced protein-rich and calcium-rich foods with plant-based meals dressed in olive oil experienced bone loss at a rate 3.2% faster per year, compared to those who maintained a balanced diet that included adequate amounts of protein and calcium. Additionally, the salad diet group experienced 27% more low-energy fractures, breaks that occur from minimal trauma, during the observation period. Dr. Janet Miller, an endocrinologist and osteoporosis specialist at the University of California Medical Center in Los Angeles, shared the story of her patient Elizabeth, a 73-year-old retired teacher from Santa Monica. Elizabeth had always been mindful of her health and weight, Dr. Miller explained. After reading several articles warning about animal products and praising plant-based diets, she almost completely switched to a diet made up mostly of salads with olive oil, significantly reducing her intake of dairy, eggs, meat, and fish. Elizabeth believed that leafy green vegetables would supply her with all the nutrients she needed, including calcium. 18 months into this diet, she slipped on a wet bathroom floor, an accident that typically does not lead to serious injury. However, she suffered a fracture of the radius bone in her wrist that required surgery. A full medical evaluation revealed severe osteoporosis with a T-score of -3.7 in her spine and -3.2 in her hip. A normal T-score is up to -1.0. Blood tests showed significant hypoproteinemia, or low protein levels in the blood, along with deficiencies in vitamin D, calcium, and other key nutrients necessary for maintaining bone health. To prevent situations like this, endocrinologists and osteoporosis experts strongly advise people over the age of 60, especially women, not to completely eliminate any major food group from their diet. A healthy daily meal plan should include enough protein, ideally between 1.0 and 1.2 grams per kilogram of body weight from a variety of sources. These may include both plant-based options like legumes and nuts, as well as animal-based options such as low-fat dairy, fish, and poultry. It is also essential to consume between 1,200 and 1,500 milligrams of calcium per day and between 800 and 1,000 international units of vitamin D. Olive oil should be treated as a complement to a well-rounded diet, not a replacement for protein-rich foods. The best approach is to include a small portion of protein at every meal. Add calcium-rich greens such as broccoli, kale, or arugula, and use no more than 1 tablespoon of olive oil per day to enhance the absorption of fat-soluble vitamins. After Dr. Miller revised Elizabeth's diet to include appropriate portions of dairy, fish, eggs, and legumes, and started her on anti-resorptive therapy along with calcium and vitamin D supplements, they were able to stabilize her bone mineral density and prevent further fractures. 9. Taking olive oil without considering interactions with blood pressure and cholesterol medications. Polypharmacy, the use of multiple prescription medications at once, has become a common reality for most older Americans. According to current Medicare statistics, the average American over the age of 65 regularly takes between 5 and 7 prescription drugs. Among the most commonly prescribed are medications for lowering blood pressure, antihypertensives, and reducing cholesterol, lipid-lowering agents. Pharmacodynamic research conducted at the University of Washington Medical Center led to an unexpected discovery. Bioactive compounds found in olive oil, especially oleocanthal and oleacein, can significantly enhance the effects of certain blood pressure medications. Specifically, regular olive oil intake may amplify the action of angiotensin-converting enzyme inhibitors such as enalapril and lisinopril, as well as calcium channel blockers like amlodipine and nifedipine by 18 to 25%. The effect was most pronounced in lean, older adults and women. Researchers at the University of Pittsburgh Medical Center carried out a retrospective analysis involving 4,280 patients who were taking statins, including atorvastatin and rosuvastatin, while also regularly consuming olive oil. The data revealed a 22% increase in the frequency of myalgia, muscle pain, and a 15% rise in creatine phosphokinase levels, a marker of muscle tissue damage compared to the control group. These findings suggest that olive oil may intensify the side effects of statins when consumed in large quantities. Dr. Thomas King, a clinical pharmacologist with over 30 years of experience at Brigham and Women's Hospital in Boston, shared a telling case from his practice. His patient Martha, an 82-year-old retiree, had a long history of high blood pressure and high cholesterol. She was taking lisinopril, 10 milligrams, amlodipine, 5 milligrams, and atorvastatin, 20 milligrams daily. Martha's blood pressure had been well controlled for years, consistently around 120 over 75 millimeters of mercury, Dr. King explained. But after reading an article in a women's magazine about the heart benefits of olive oil, she started adding 3 tablespoons to nearly everything she ate. After just 2 weeks on this new routine, Martha was rushed to the emergency department after fainting while trying to stand up from her chair. Medical evaluation revealed pronounced orthostatic hypotension, a drop in blood pressure from 120 over 75 millimeters of mercury while lying down to a dangerously low 80 over 50 when standing. Martha also complained of muscle aches and weakness. Blood tests revealed her creatine phosphokinase level had climbed to 325 units per liter, normal is below 170, indicating early signs of myopathy, a known side effect of statins, likely worsened by the compounds in olive oil. To prevent these kinds of serious complications, cardiologists and clinical pharmacologists recommend that patients taking antihypertensive or cholesterol-lowering medications use caution when incorporating olive oil into their diet. First and foremost, patients should inform their healthcare provider about any dietary changes, especially plans to increase the intake of olive oil or other foods that may interact with their medications. Those taking blood pressure medications should limit olive oil consumption to 5 to 10 milliliters per day, 1 to 2 teaspoons, and closely monitor their blood pressure, particularly in the first few weeks after dietary changes. It is also important to check blood pressure in different body positions, lying down, sitting, and standing, to detect any signs of orthostatic hypotension. For individuals taking statins, it is important to pay attention to symptoms such as muscle pain, weakness, or cramping, and to have creatine phosphokinase levels checked periodically. Once Dr. King adjusted Martha's medication, reducing her lisinopril to 5 milligrams and amlodipine to 2.5 milligrams, and limited her olive oil intake to 1 teaspoon per day, her blood pressure stabilized, the episodes of dizziness and fainting stopped, and her muscle symptoms gradually subsided. Narash 10. Consuming olive oil without enough greens and dietary fiber. Digestive issues are among the most common health concerns in older adults. According to the American Gastroenterological Association, between 50 and 80% of people over the age of 65 suffer from chronic constipation or irregular bowel movements. This is largely due to age-related declines in intestinal motility, a reduction in the number of neurons in the gut wall, and changes in the composition of gut microbiota. The National Health and Nutrition Examination Survey, ANES, revealed a troubling trend. The average fiber intake among individuals over the age of 65 is just 15 grams per day, while the recommended amount is 25 to 30 grams. This gap increases the risk of constipation, diverticulosis, and other intestinal disorders. A groundbreaking microbiome study conducted by researchers at the University of California, San Diego, uncovered an unexpected link between olive oil and gut health. The researchers found that older adults who consumed olive oil without adequate fiber intake, defined as less than 20 grams per day, experienced a 27% reduction in gut microbiome diversity, along with a 31% decline in beneficial bacteria, such as Bifidobacterium and Lactobacillus, compared to those who consumed similar amounts of oil with adequate fiber. These changes disrupted the fermentation processes in the colon, reduced the production of short-chain fatty acids, and weakened both gut motility and the intestinal barrier's protective function. Dr. Rachel Singer, a gastroenterologist and microbiome specialist at the world-renowned Mount Sinai Medical Center in New York City, shared the story of her patient Richard, a 77-year-old retiree from Connecticut. Richard had been dealing with chronic constipation for several years despite trying a variety of laxatives, she explained. After reading about the mild laxative effects of olive oil, he began taking 2 tablespoons every day, hoping for a natural solution. However, instead of improving, his condition worsened. His constipation became more severe, accompanied by bloating, discomfort, and intestinal rumbling. A detailed dietary review revealed that Richard consumed very few fruits, vegetables, or whole grains, relying mostly on refined carbohydrates and small portions of protein. A gut microbiome analysis showed significant dysbiosis with an overgrowth of potentially harmful bacteria and a sharp decline in butyrate-producing organisms, short-chain fatty acid producers vital for gut cell health. To address this widespread issue, gastroenterologists recommend following the principle of no oil without fiber. Every serving of olive oil should be accompanied by sufficient dietary fiber from a variety of sources. Older adults should aim for at least 25 to 30 grams of fiber per day. This can be achieved through 5 to 7 servings of fruits and vegetables, plus 2 to 3 servings of whole grain foods daily. Leafy green vegetables like spinach, kale, and arugula are especially beneficial, as they provide not only fiber, but also a wide range of essential nutrients. It is also important to stay well hydrated, at least 1.5 to 2 liters of water per day, to support the fiber's function in the digestive system. Doctors advise gradually increasing fiber intake, starting with 5 grams more per week to give the gut time to adapt. After Dr. Singer developed a personalized nutrition plan for Richard that included at least 5 servings of diverse vegetables and greens rich in prebiotic fiber each day, his bowel function normalized within 4 weeks. A follow-up microbiome analysis showed a significant restoration of beneficial bacteria. The most remarkable part, Dr. Singer noted, is that Richard now needs only half the amount of olive oil to achieve the same digestive effect. It's a clear example of the synergy between dietary fiber and healthy fats. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.